Hello friends, welcome back to Love Medics. If we want to do anything or any work, we should know the basic. Likewise, before interpret the ECG, we should know the basics of ECG. In this video, I am going to explain about the basics of ECG. Content of the video: introduction, conduction system of heart, normal ECG wave indication and duration, ECG machine, lead placement, 12 leads of ECG and its indications, and ECG paper. Electrocardiogram. Electrocardiogram. ECG. Electrocardiogram. ECG means what? It is the graphical recording of the electrical activity of heart during cardiac cycle, and the electrical activity, which means electrical signal produced by someone. Who is that? SA node. SA node produces the electrical signal and it passes to all segment of the heart, that is conduction system of heart. The components of conduction system are SA node, AV node, bundle of his right and left bundle branches, and Purkinje fibers. Conduction system of heart: SA node, AV node, bundle of his left and right, and Purkinje fibers. Normal ECG wave. These waves are produced due to the changes in the heart. The waves are P wave, QRS complex, T wave and U wave, PR interval, PR segment, QT interval, and ST segment. ECG wave. Each wave indicates the electrical changes of heart. P wave that indicate atrial depolarization. It means atrial contraction. QRS complex produced due to ventricular depolarization. It means ventricular contraction. T wave, it is produced due to ventricular repolarization. It means ventricular relaxation. Now, we had one doubt. Ventricle is contracting and relaxing. Atrium is contracting. When the atrium is relaxing? Yes. The atrial relaxation is also recorded in the QRS complex wave. ECG wave indication: P wave produced due to atrial contraction. QRS complex, it is produced due to ventricular contraction. T wave, it produced due to ventricular relaxation. Each ECG wave has some durations. The duration of P wave is 0.12 second. 3 small boxes. This is P wave. 1, 2, 3. 3 small boxes or 2.5 small boxes. PR segment, it means 0.05 to 0.12 second. It means approximately 1.5 to 3 small boxes. 2.5 small boxes. PR interval. This is PR segment from the end of the P wave to Q wave, and PR interval means from the starting of P wave to the Q wave. The duration of PR interval is 0.12 second to 0.2 second. It means 3 to 5 small boxes. The duration of QRS complex is 0.06 second to 1 second. It means 1.5 to 2.5 small boxes. 1, 2, 2.5 small boxes. QT interval. It is from the Q wave to the T wave. The duration of QT interval is 0.3 second to 0.4 second. It has largest duration, that is 1.5 to 2 large boxes. This is one large box. This is ST segment from S wave to T wave. The duration of ST segment is 0.08 second, which means 2 small boxes. 1, 2, 2 small boxes. The ECG waves are recorded by ECG machine. This is the ECG machine. The machine records the activity of heart and produces the ECG wave in the ECG paper. What is the connection between the machine and the patient? That is ECG leads. We should place the ECG leads on patient in a particular region. First, V1. We place the V1 in fourth intercostal space. This is the intercostal space and right sternal edge. Fourth intercostal space, right sternal edge. V2. We should place the V2 lead in fourth intercostal space, left sternal edge. And V4. We should place the V4 in fifth intercostal space and mid clavicular line. This is clavicle, this is the mid clavicular line. We should place the V4 in mid clavicular line, and the V3 is placed between V2 and V4. And V5, place the V5 left anterior axillary line. This is the axillary line. Before that, anterior axillary line. We should place the V5 lead straight to the V4. We place the 12 leads in the patient. Now you have one doubt. Chest lead 6, and we place the 2 leads in the hands and 2 leads in the legs. Then where is the 2 leads? We place the 6 leads in chest and limb leads are 6. The limb leads are, some are bipolar leads and some leads are unipolar leads. Bipolar leads are 1, 2, 3 and unipolar leads are AVR, AVL and AVF. Bipolar lead, that is 1. It is the connection of right hand to the left hand. Lead 2, it is the connection of right hand to the left leg. And lead 3 is the connection of left hand to the left leg. Then why we place the lead in the left leg? That is the earth connection. And unipolar leads are AVR, AVL and AVF. These are the limb leads. Lead 1, this is lead 2 and this one is lead 3 and this is AVR right side, AVL left side, AVF, that is foot side, inferior view. We can see the activity of heart with 12 leads of ECG in different angle or different view. The limb lead, that is bipolar lead, lead 1 is, we see the heart from the left side of heart, and lead 2 is from the inferior left angle view, and lead 3 is inferior right angle view. Unipolar leads AVR from upper right side view and AVL is the upper left side view, AVF is the inferior view. Each lead represent the some area of heart. V1, V2 are represent the septal activity of heart. V3 and V4 that represent the anterior wall activity of heart, and V5, V6 are represent the lateral wall activity of heart. These leads are help to identify the location of block, that is coronary artery block. We should not take the ECG wave in any paper. We should take the ECG in ECG paper only. It has small boxes and large boxes. This is one small box and this is the one large box. One small box length is 1 mm and its timing is 0.004 second and its speed is 0.1 millivolt. One small box is 1 mm. Then 5 small boxes 5 mm. One large box has 5 small box, so its length is 5 mm and its timing is 0.02 second and its speed is 0.5 millivolt. And 5 large box, 1, 2, 3, 4, 5. 5 large box is 1 second, that is 25 mm. Its speed is 25 millivolt. ECG paper, this is ECG paper. We can record the ECG wave in the ECG paper, and the speed of the ECG paper is 25 mm per second. This is one small box and this is one large box, and 5 large boxes 1 second. These are the normal ECG wave recorded by 12 leads of ECG in different angle. Basics of ECG overview. ECG is the graphical recording of electrical activity of heart during cardiac cycle. The electrical signal is produced by SA node. That electrical signal spread to heart. by conduction system of heart, that is SC node. From SC node it passes to AV node, bundle of his right and left bundle branches and Purkinje fibers. It produces the ECG wave, that are P wave, QRS complex and T wave. These waves are produced due to changes of the heart. P wave indicate the atrial depolarization, QRS complex indicate the ventricular depolarization, T wave indicate the ventricular repolarization. These activities are recorded in the ECG machine by place the ECG leads on the patient, and these waves are recorded in the ECG paper, and we see the cardiac activity in different angle. That's why we use the leads. Question time. Electrical impulse of the heart is produced by SA node. P wave produced due to atrial depolarization. Duration of ST segment is 0.08 second, that is 2 small boxes. Placement of lead P1 is 4th intercostal space and right sternal edge. What are the bipolar leads? Lead 1, lead 2 and lead 3. AVF lead view is inferior view. 5 large box is equal to how many seconds? 1 second. Length of small box is 1 mm and B1, B2 lead represent the septal wall activity. Thanks for watching.